All right, welcome back. Once again, we are joined by Mr. David Theriot and Mr. Jacque Blanchard. There you see them, both on the Cardiovascular Institute of the South team. What a great team it was, and how lucky are we since the early or mid-'80s to have an institution like this in the area. But they branched out. It's not just Terrebonne and Houma anymore. And each time I talk to Dr. Craig Walker, it seems to be another clinic popping up somewhere. So I might be 14 or 15 now if I get the number right. But nonetheless, two guys I've been knowing for a long, long time. And Jacque, I think we probably met through our parents, who were both affiliated with St. Francis, right?
That's correct. My mom taught there for years and years, and your mom was administrative assistant or secretary. In fact, she took my temperature quite a few times when I tried to play hooky to get out of St. Francis. So go back a long way.
And knowing my mom, she probably knew you were playing hooky, right?
Yep. And
just a little temperature, get back to class.
Send me back to class. That's right.
What was the temperature? It always come back normal?
Pretty much, I believe so.
And David, we go way back to the St. Francis day camp days. That was some good times, huh?
Yeah, back in those days when you used to provide us our drinks for lunch at day camp, and I was telling Jacque earlier that you'd entertain us while we were having lunch by dunking the ball.
Yeah.
So,
but let's reiterate, those drinks were Cokes.
Yeah, that's
they were
right.
Not drinks. We were too young back in the day. First of all, I want to congratulate y'all. That's a pretty big, as I was reading it, and Bevy sent me the information, and I was reading it in my office. I said, we got to get these two guys on. They do a great job. And usually, not to take any away from Dr. Craig and all the doctors for that matter, that really are the front centerpieces of CIS. But when you go in to get treatment or you go in to get consultation, you run into you guys a lot. You run into a lot of support personnel. So to be listed on the 2017 HealthCare Heroes by, this isn't only Houma, this is New Orleans, the metro area. It's quite a big accomplishment. So congratulations to start off on that.
Thanks, Martin.
Pretty nice recognition as we move forward. So let's talk about, I want this to be more than just a medical show, although we're going to get into medical aspects of it. And Bevy was so kind as to give us a lot of information on you guys to fill in the blanks. So I just want to go over it. And Jacque, we'll start with you. First of all, when you found out you were recognized about the award, had to be a little hoorah for you, didn't it?
Yeah, it's nice to be recognized. You mentioned that Dave and I are usually kind of behind the scenes, at the hospital every day. And to be honest with you, I prefer to be behind the scenes and not here sitting with you doing this interview. But I did enjoy the fact that, or appreciate the fact that my peers recognized me and nominated me for this award. That means a lot, because that means that they appreciate what I do every day, and that means more than any award I'll ever receive, to be honest with you.
Okay. And David, how'd you feel when you found out?
I was a little surprised. I got an email from the HealthCare Heroes organization, and I sent it to the administrative assistant and said, is this real? And it got sent around, and it's like, yeah, you were nominated and a committee voted on you and you've been elected to this group. So yeah, I think it's always an honor when someone recognizes your work. To me, it's humbling, and it makes me reflect on, the opportunities that brought me here, especially opportunities that Dr. Walker created for a lot of people who have joined the organization. And it makes me reflect on all the teams of people that we work with within CIS and at the hospital. There's many teams that all work together for common goals. And so in one way, I just kind of feel like I'm an ambassador for all of those people, because it takes everybody to get the job done.
As you make some good points, but as you go through a span of time and you watch you two guys grow through the system, I remember when we were first starting off here at HTV and we were going in to film medical shows. You guys looked like you were just out of high school. And you probably were,
Yeah,
for
we
that
were
matter.
back then, yeah.
Y'all started young, and of course, Jacque is the cath lab director now. That's quite a responsibility that goes with that. And David, you're the team leader of the nurse practitioners at CIS. And so with years of experience comes a lot of responsibility. And I know that when those doctors place that responsibility on you guys, it's not just a title. Y'all have earned it, and you've been in the foxhole, and you've seen the innovations. Jacque, how far has it come over the span you've been there? You've seen so many changes, but changes for the better.
Absolutely. It's been about 25 years I've been in the cath lab, and it's been an amazing difference. You know, we can treat people so much quicker, so much faster, and we get them in and out of the hospital so much quicker now. We can turn them around. The technology, you can't keep up, really. It's every day there's a new technology out there that we're trying to bring to our patients. And fortunately for CIS and the people of this area, this community, we usually do get that technology as soon or before anybody else. And it's made a tremendous difference in the health care, the cardiovascular care that people receive in this area.
David, let me turn to you. As you know, I've watched the doctors. I've seen them go in there many times. And you know, a lot of people think the doctors just go into the office and say, all right, this is how we're going to do it. And a lot of times they may, if they're that sure of what they're going to do. But I've seen them consult, and I've seen them ask a lot of questions of you guys. So over the years, they put a lot of faith in y'all opinion and what y'all actually think. Is y'all, from the ground level, know that patient pretty good.
Yeah, that's one of the most rewarding aspects of being a nurse practitioner at CIS is the collaboration that we have with the physicians. In a lot of ways, the nurse practitioners are the first responders in the hospital. So we're responding to emergencies, taking care of patients' needs immediately. Very often we're collaborating with that cardiologist to develop a plan to get that patient improved quicker. And one of the things in the emergency room that constantly amazes me, even after all these years, is how we can have someone in there having an acute heart attack and so unstable. We're trying to stabilize them with medications, at least long enough to get them to the cath lab to get that artery open that's causing their heart attack. And then half an hour later, their blood flow is restored in the artery, and they're like a different person, and you're having a conversation with them. And it just never ceases to amaze me how dramatic that, you know, that improvement is in that type of patient.
Let me ask you guys, like I said, we go way back, and people in this community know each other from before they chose their profession. So there's a lot of camaraderie, there's a lot of joking. I see Jacque and his gang downtown having coffee on Saturday mornings, and you know, there's no secrets among friends. There's a lot of teasing that goes on, a lot of joking. Everybody knows everybody from like day camp or before when our mothers worked together. But at one point in your life, you have to choose a profession. You get to the point where you say, well, what am I doing? I can't joke around with my buddies the rest of our life, and you choose a profession. Jacque, 25 years later, you're being recognized, but where was the start? Where was the catalyst of why you chose to do what you're doing?
It's, think about that oftentimes, and you know, the standard canned response for nurses is, I want to help people. Well, obviously we all want to help people. But I think what really made a difference in my life is when I was 12, just almost 13 years old, I had a traumatic accident where I was hospitalized for 3 weeks and intensive care, the whole deal. And the care that I received and the friendships that were made over that time with my family, myself and those nurses and physicians, that still to this day, Sharon Burrow and Lawrence Burrow, I mean, Sharon took care of me, and you know, the names go on, but those people are still some of my dear friends because, you know, my family and myself appreciated the care that I received and the things they did for me. And I really think that's probably why I chose medicine, because nobody else in my family was in medicine at that time. And I think that I would have to pinpoint that circumstance.
Okay. And David, of course, temperament has a lot to do sometimes with the job you pick. You got a good temperament. People who have been around you know that they're in stressful times. Like y'all were joking when you walked in the studio, you said, now we know how you feel when you walk in the hospital. Everybody, when they're out of their element, feels a little uncomfortable. They don't know the fear of the unknown. But temperament has a lot to do with it, and you have a great temperament with that. But when did you know your temperament was suited to do what you're doing today?
I was fortunate as a teenager. I got to work in the hospital. Some people my age were working as candy stripers, volunteer, and I had the opportunity to work as a transporter one summer, moving patients from place to place. And on the first day, I was holding an emesis basin. I didn't know what I was doing. My thumb was in the emesis basin, and the person was, vomiting, and so my thumb is sitting in the vomit. And I'm like, okay, this is interesting. They didn't wear gloves all the time like we do now. Right. So washed my hands and said, I can handle this. And just from there, I had opportunity to work in the emergency room, and a lot of opportunities came up over the years to work in Bayou Oaks and Nursing Care Incorporated, where Dottie Landry was. Mm-hmm. And so I just had so many opportunities and everything. I enjoyed working with people, so it just seemed natural.
Yeah, and of course education plays a big part in getting you to that point. Jacque, talk about your education a little bit to get to that role.
Well, I obviously graduated from Terrebonne High School and went to Nichols. And when I went to Nichols, I really didn't know. I think my first major was biology, and then changed it a couple times. But then I ended up deciding that nursing was going to be for me. And fortunately, Nichols nursing is outstanding. I mean, still to this day, Nichols scores on the NCLEX are, better than anybody else's in the state. So it's a great nursing school. And, at the time, financially, it made sense to me to go to Nichols. So I graduated from Nichols State University and with a bachelor's in nursing, and went right to work at Terrebonne General from there.
Okay. And David, how about your education?
I also started in biology, and then later switched to nursing. And I graduated from Nichols State University, and then I got my graduate degree at the University of South Alabama in Mobile. And I really have had some great mentors at Nichols and at USA that when you have mentors like that are encouraging you and teaching you. And then before I went to graduate school, I had worked in the ICU at Terrebonne General, and we had great mentors there. The nurses that kind of took us under their wings and taught us how to take care of these critically ill patients. So I think that's been the key over the years, is just a series of people that really had a interest in seeing you develop. Mm-hmm. And then when Dr. Walker and Gary Chasson, came to me in the critical care and said, we want you to join our team, it was a continuation of that process.
As you look at CIS, and we go back to '84 or whatever, when Craig Walker looked like he just walked out of South Terrebonne. And we sitting here at the station interviewing guys that really looked, they looked like boys. They were so young. But the spirit of innovation was so, not only aggressive is the proper word, but they were challenged. They were challenged that people said, no, you can't do this, or that's never been done before. And I think that just lit them to a degree where they said, oh, yeah, I think we can, so we're going to try. So they've tried different techniques. I can tell you how many times we've been called into the cath lab, and it looks like a spaceship. when you walk in, you got all these monitors and you got everybody in another room in suits, you know, dressed up for obvious reasons. And you'll start beaming this up to the world, for that matter, to see and to teach and to learn. And that was right here in Houma. So the groundbreaking, I guess what I'm saying is, for the audience, what a trophy for Houma to have right here. And you got other experts and other doctors across the world looking at all these feeds and going, wow, I learned something from Houma, Louisiana. So when CIS teamed up with Terrebonne General Medical Center, I'm here to say it put Houma on the map pretty big time. That had to be encouraging working in that kind of atmosphere.
Absolutely. It's you mentioned Terrebonne General and CIS. It's been a great partnership for both. CIS has brought some incredible technology to this area. Terrebonne General's supported everything that CIS has done, and vice versa. And you've, like you said, you've been in the lab. We've had doctors from all over, and we've sent, you know, footage of what we're doing live many times over. And it's always the latest and greatest cutting edge technology. And you know, I hope people realize that we have that right back in our own backyard here in Houma, Louisiana, down the bayou. You know, people come, they say they're driving in from New Orleans and they don't know if they're going to get to land. They just keep seeing water, and eventually they get to Terrebonne General, and they're amazed by the things that we're doing right down here in you know, in Little Houma.
You know, David, as we go to a break, how many times have we covered the Cardiovascular Horizons seminars that go on? And it never fails. Every time I go to Dr. Walker and I say, okay, who are we interviewing tonight? Well, Martin, this guy invented the clutch. Yeah. I don't know, what's the clutch have to do with a balloon but people who, and he was a doctor, okay, he was a heart surgeon. I think heart surgeons in general, a lot of them are inventors. They like to tweak things and make it better, so when that balloon's going up, and y'all see it all the time, there's always a sense, how can we improve this? So satisfaction is never really a benchmark over there. Everybody's trying to push the envelope a little bit.
Yeah, I think we tend to take for granted, you know, the caliber of physicians that we have here, but we have brilliant cardiologists. If you go to a national conference and you have a conversation with somebody, they've either heard of Cardiovascular Institute of the South, or they know of one of our cardiologists. Mm-hmm. And so it's all been part of Dr. Walker's vision, and you got to give him credit, you know, to get Dr. Ladd and Dr. Rabin and Dr. Stagg, those guys that kind of got it going, and you know, and now have Dr. Fail, and now Dr. Neal's exploring into venous work. It continues to grow, and it's amazing to watch how his vision is, you know, comes to fruition here.
A little funny aside, did Dr. Stagg ever tell y'all his first fishing trip?
I believe it was with you, huh, Martin?
We took him, and
you had some really short shorts back then, if I remember right.
It was me and Dr. Craig Walk and Dr. Jody Stagg, and we brought cameras along. This was one of those fishing trips, and I don't know if Mike was on this trip or not. I'd have to look back on the tape, but it was a bad day fishing. We went Sister Lake. We went everywhere. We tried. Bad day. On the way back in, said, how about if we make one more stop? And we stopped. We stopped coming right into Sister Lake at those cement jetties. Boom. I mean, it went crazy. But the only problem is Dr. Stagg was not an astute fisherman, and he kept backlashing all his tosses. So while everybody else was catching fish, half my time was getting bird nests out of his line. But when the film was edited, he looked like a highly trained professional, so he was thankful.
That's great editing.
Yeah, look, and I don't mind saying it on TV because he's told it to many people on TV. He gets a kick out of that. But isn't that the good part? They're all fun to be around too. They all have their funner moments.
So healthcare is a very stressful environment, as you know, and it's tough, and some of the things we challenge with every day is very difficult. So it's important to have fun when we're not working, and build that team, that camaraderie like you're talking about.
And I didn't know Dr. Phil played the piano till I interviewed him.
Dr. Phil has a lot of talents he doesn't talk about. He's probably one of the more quiet, reserved guys, but there's a lot of talents under there that get to see every now and then.
And the quiet one, Dr. Ladd.
Yeah, Dr. Ladd's, I would say quiet, huh? Depends what you're talking about. If you want to talk politics, he's not quiet anymore.
Well, y'all know him better.
Yeah.
Dr. Ladd has been the rock for a long time. He's that steady voice, and for a long time, that's how they counted on him within the organization.
The father figure. I mean, he's always there for good advice. It's going to be sound and well thought out every time. So that's kind of how I look at him. He's consistent.
And Craig's a promoter. He goes out there and he puts the things out there that people need to see, and he has a gift, first of all, for speaking.
Absolutely.
Craig's an excellent speaker, but then when he gets up there and he presents his case, he can mesmerize you. And I had to tell him way back, I never forget our first interview we ever had, myocardial infarction. And he threw that at me, and I went, Doc, what is a myocardial infarction? He goes, it's a heart attack. I said, well, just say heart attack.
Break it down for me.
General public out there, we don't know what a myocardial infarction is. But
that's right.
He's very smart, very good at what he does, and I think he does a great job now bringing it to where people can understand it quite a bit. We'll take a break. When we come back, we'll have more in-depth coverage. We'll get into these guys a little bit. It's not all about the doctors today. We want to sort of showcase a support team, and I got a whole nother line of questioning we'll go into. We'll be right back.